Hello, everyone, and welcome to February's Adult AML Chapter event brought to you by the HealthTree Community for AML program. My name is Katie Braswell, and I'm the HealthTree for AML Community Director. I'm very grateful to have each of you here for our meeting today and for your support in building this adult AML community. I'd like to let you know that today's session will be recorded, and the recording, along with any resources we discussed today, will be sent to you via email to all registrants within 48 hours after the event has concluded. I'm going to quickly walk you through some important Zoom features just in case you are new to using the Zoom platform. If you hover over the bottom of your Zoom screen, you will see a row of icons appear. To turn your video on, you will press the Start Video button and press it again in order to turn your video off. We would love for you all to keep your cameras on if you feel comfortable. Doing so helps to create a stronger sense of community. Each of your microphones should be muted and will be kept off by our team throughout most of the event. You may unmute yourself during our discussion time at the end. Press the chat icon to open up the chat box. If you have any questions or comments for us or for our speaker throughout her presentation, please type them here. And lastly, if you'd like to verbally ask a question during the discussion session, you will click on reactions and then the raise hand option. We will review all of this again after Ilana's presentation. And now let's get started with today's event. First, I'd like to thank our sponsors without whom this event would not be possible: Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. The topic of our event today is titled Long-Term Survivorship After Stem Cell Transplant. Here's the agenda for today. I will introduce our speaker, Ilana Massi, and she'll spend the next 30 minutes giving us her presentation. After the presentation, we will open it up for your questions and comments and end the event with a few announcements on upcoming events. So let me take a second to introduce our speaker, Ilana Massi. Ilana is a lifetime resident of the Los Angeles area. She has been married to her husband, Bob, for over 40 years. She has 5 sons, 3 daughters-in-law, and 3 grandsons. Trained as a pediatric ICU nurse, she has a wide variety of jobs during her nearly 40-year career, including research and professional education in the area of multiple sclerosis. She was diagnosed in 2014 with an aggressive form of AML. She received a stem cell transplant from a selfless donor in 2015 and today is a 7-year survivor. She is now retired and committed to paying it forward through volunteer work for blood cancer organizations. She loves spending time with her family and appreciating every day. We are so happy to have you here with us today, Ilana, and are so grateful for all the work you do as an AML patient advocate. So with that, I'll let you go ahead and get started.
Thank you, Katie, and welcome to everyone on the line. I've been looking forward to this opportunity. And Katie has asked me to start with a little bit of my story of how I was diagnosed and my course of treatment. And of course, remembering that everybody has a different experience. But mine is a bit unique in that I'm a 7-year survivor and still sick. Still pretty sick, not with leukemia, but with graft versus host disease. However, I'm going to do something a little unusual and stand up for a minute so you guys can see my my sweatshirt. I hope you can see 7-year survivor and leukemia awareness. My friends, I just had my 7th birthday, and my friends surprised me with the sweatshirt and a little impromptu party. So, where was I? Well, before I was diagnosed, I had a very challenging career. I did a lot of traveling, and as Katie mentioned in the intro, I worked in the area of research and professional education for multiple sclerosis, and for the last 20 years worked for several large pharmaceutical companies, not on the sales side. And of course, leveraging my background as a nurse. And I was a bit of a health nut. My boys used to always tease me. I was a runner and did some weightlifting and always was very conscious of my diet. I never smoked and very rarely drank, and really tried to keep up on my regular health screenings. And I only was taking one prescription medication at that time. And then one day not one day, I was at a work meeting, actually a Wharton. It was a leadership conference. And I got there, I didn't have any other symptoms, and I felt this weird dry cough. And I was supposed to be there Monday through Friday. And by Wednesday, I was feeling so sick, I couldn't even go to the meeting. So I called my husband. I said, listen, I'm going to fly home a day early. So I came on Thursday night and actually felt a little better after everybody glaring at me for hours while I was coughing on the plane. And then I spiked a fever on Friday night of 103, and I obviously doctor's offices were closed, so we ended up in the ER. And the triage nurse took my pulse saturation, my pulse ox, and normal, of course, is higher than 95, and mine was 84. And she kind of looked at me and said, "How are you still standing and walking around?" So, cut to the short. Obviously, they started with an X-ray and blood work because we pretty much assumed I had pneumonia. And what they found was that my X-ray actually didn't look too bad, but my white count when it came in normal, I'm sure most people are familiar with it on the line, but normal would be in the range of 4 to 10,000, and mine was 107,000. And I looked at my husband, I said, I have leukemia, because of course with my background knowledge, I knew that there's nothing else that can produce those kind of numbers. And then because it was so late at night, they admitted me, but the oncologist didn't come in till the next morning. And during the night, I remember I was, of course, didn't get much sleep, but I was thinking, please not AML, please not AML, because of course I knew that that's the hardest to treat and the most aggressive. In the morning, the oncologist came in. I was just in my community hospital near where I live. I live in a suburb of Los Angeles. And he came in, and my white count was so high, he didn't even have to do a bone marrow biopsy because he had plenty of leukemia cells in my circulating in my blood in order to make the diagnosis of AML. And I had a pretty common mutation, especially for patients over the age of 60, which is the FLT3 mutation. That's an oncogene that basically revs up and makes your leukemia even more aggressive. So they immediately started me on the 7+3, which now has been replaced in most places by a more advanced chemo regimen. But at that time, unfortunately, I was not able to get into remission. And as soon as my white count came back, so did the leukemia. So I was transferred to City of Hope, which is located again in LA County, and has long been known as an expert. Their hospital basically is 90% blood cancer patients. And they have a whole 2 floors of patients waiting for stem cell transplants or bone marrow transplants. And that was what I was going to need to do, was get a transplant. However, first they had to get me in remission. It ended up taking me 7 different courses of chemo just to get into remission, which opened the door to be able to do the transplant. And then we had to search for a donor. None of my siblings were a match. They were testing my children in case they needed to go with a haploidentical transplant. And we went out to the Be the Match bone marrow registry, which internationally has about 24 million people in the registry, potential donors. And I had 7 matches, which was, my oncologist at the City of Hope said, well, I really prefer that people have about 20 or 25 at least, because patients, unfortunately, some people in the registry, when they're approached, just say no. They've been in it for years. It's amazing that 40%, I learned from Be the Match, 40% of the people in the registry, if and when they're approached to make a stem cell donation actually refused. So make a long story short, my doctor was very concerned about being able to get this transplant, get this donor going and approved, and get my transplant done before I potentially slipped out of remission. So the first person that answered out of the 7, and 4 of the 7 were not in the United States, so that made it even more kind of complicated logistically to move quickly. Very first one who answered was, I found out later, an anesthesiologist in Florida, and he was not a perfect match. So I ended up getting a unrelated mismatched transplant because that was the best we could get. And the number of people who are getting mismatched transplants is actually increasing because management of stem cell transplants has gotten so much better, being able to manage the immediate complications after that. And so that was a big part of the factor that my doctor said. He said, you know, we need to do this transplant now. We can't wait. You're too sick, but you're almost certainly going to get graft versus host disease. And the question is when and how bad. So I had a really, really good 2 years after my transplant. I eventually went home after 5.5 months in the hospital. And, you know, I couldn't go home in between because my white count was so low that they had me obviously in isolation in the hospital. And I went home, I felt great. Obviously there was a lot of anxiety. I'm sure a lot of you guys have lived through that with your bone marrow, you know, bone marrow biopsy on almost every visit, and then holding your breath until you find out that it's continued to be negative. And the transplant engrafted beautifully, almost immediately started producing new white cells. And then about 6 months after I went home, I got a brief flare of acute graft versus host disease. And I don't know how many of you are familiar with, I hope not too many of you have it, but basically what happens in graft versus host disease is that, of course, your immune system, which your white cells, your whole immune system that's produced by your bone marrow, and I'm making this very simplified, obviously, it's the whole job. The whole job of the immune system is to seek and destroy things that don't belong there in the body, and so it's looking for cells that don't match their own cells, what the cells look like, because basically the DNA in all of your cells in your body is the same, and mine was a little bit different. What's interesting is I originally had B positive blood. My donor was A positive, and my blood type changed, and which was kind of weird to think about. And actually, my doctor was joking around, and he said, you know, if you ever went into committed a crime or something, and they were looking for blood samples, they would find they would be chasing my donor instead of me, because it was really his blood. But in any case, because I was not a perfect match, the blood that I had, the immune system that was being produced by my new bone marrow from my donor, was not a perfect match to all the rest of my body's cells. And so they did what they're supposed to do, which was go out and try to destroy cells that didn't match. And so, you know, the cells were very robust and doing a good job. And unfortunately, it started having a lot of complications. My GDHD really mainly affected my skin, which is the most common place for it to attack. And my skin started to get scarred and very, very hardened, almost like it's called sclerodermatous GDHD, because it's almost like scleroderma, where you get very hard skin, and it also affects the fascia underneath. And there was a point where I couldn't raise my arms above my shoulders because my skin was so stiff. It was mainly on my arms, and then it spread to my back and my legs as well. And so in order to combat that, basically they have to tamp down your immune system. And they do that through a number of drugs. There's so many drugs being developed now to handle GDHD, since so many more patients, thank goodness, are surviving their transplants and then, running into this serious complication after that. But at the very outset, when I went to the City of Hope, and again, I saw the video that came on before this, and there was a big focus on one of your first jobs as a patient is to make sure that you're at the right place. And usually a community hospital is not the right place to manage AML. It's a rare cancer. And so even community oncologists who would see a lot of breast cancer and colon cancer and prostate cancer, which are, relatively much more common, they don't see a lot of AML. And there's so many new drugs and new treatments coming out, new ways to manage it that can improve long-term survivorship. And so you really need to go to a center of excellence. And it was great to see that that was part of the HealthTree AML, the map there with all of the great places. The other thing is, if you're not at a place where they're really experts, you may not get all the treatments that are available to you now. So I just can't emphasize enough. I was blessed to have City of Hope, which is right in LA. So it's a long drive. It's about 130 miles round trip for us, and we've made that drive many times. But it's made such a difference in being able to manage serious complications. So I've now had GDHD for 5 years. And during that time, I've never gotten off of steroids. I've been very immune suppressed the whole time, so you can imagine. I'm sure many of you are in the same boat of being very nervous about COVID. I basically been in my house ever since COVID started. I don't shop. My husband won't let me shop, even grocery shop or anything. And I think one of the other key things is, as you get further out from your transplant, and even if you have a mild case of GVHD or a more severe case like mine, it's really being aware of and being educated on what to look for. My GVHD mainly affected my skin, but it also affected my eyes, causing very, very dry eyes, and can actually have fibers grow on the cornea, which in severe cases. And when I mentioned it to my doctor, well, they had an ophthalmologist who specialized in GVHD. And so obviously he referred me there. Also, I had affected my GI tract. I had a lot of GI upsets all the time. And that went on for about 3 years. So, there's things you really need to be educated on: what GVHD is, what your limitations are, and who can best treat you. So in the course of this, believe it or not, I have over 20 specialists now. I have a patient portal at each of the hospitals that I'm at, because some of the surgeries that I've had were not done at the City of Hope. And another thing is that I wanted to encourage you guys, if you haven't signed up for it and really used it, is almost every large hospital in healthcare institution has patient portals now. And they are so great because, first of all, you can see the doctor's reports, you can see your lab work, and you can get a better sense. Sometimes lab work gets overlooked. And so it's really important to, kind of watch your stuff. But here's the thing. Every lab is different. They have different normals. pay attention to the normal from the lab you're using and not what someone else has. The main thing is what I would suggest from my own experience is that if something, if something pops up as either abnormally low or abnormally high, that you call it to your doctor's attention the next time you're in, or even set a note through the portal. And the other thing is that I'm sure you guys have experienced that some of these numbers pop around a lot. They're up and then down every time you go in. It seems like one time it was abnormal, and then the next time you go in, it was perfectly normal. And so one of the things that I do frequently with some of my labs that are right on the edge of either being too low or too high is I kind of watch it through, there's an ability to actually graph your lab results on the portal. And that's so important, I think, because what you really want to look for is a trend. And I'll give you an illustration of that where, in the hustle and bustle of time, right after I was diagnosed and then waiting for the transplant, everybody was really focused, obviously, on just keeping me alive and getting rid of the leukemia, which they succeeded in doing. However, nobody had run a lipid panel to check my cholesterol and triglycerides, which many of the drugs that you get during and after treatment for prep for the transplant and also treatment afterwards can cause your lipids to rise dramatically. And when I finally said to the doctor, I don't think I've had my cholesterol checked in a long time. It was 350, which for those of you who are familiar, it's not supposed to be over 200. So, that was just things, even at the best institution, things fall through the cracks. And that's why you have to be an advocate for yourself. My parents, as they aged, and they would go to the doctor, and then they'd call me. I was the nurse in the family. I was also the only local child of theirs. And, my dad would say, well, the doctor started me on a new drug. Oh, what drug? I don't know. Well, what's it for? I don't know. And, I would get frustrated with them and say, Mom and Dad, at the end of the day, you're the person who goes home with this disease, not the doctor. And really trying to get them, and I've tried to use those same lessons with myself. I think what's important for everybody is to figure out what kind of patient you are. And I was blessed. My oncologist had I've never had that interaction with the doctor. After I met him the first time and he did the whole the consultation, my first oncologist at City of Hope, and he said to me, so what kind of relationship do you want us to have? Which, of course, was very, very unusual. And I was able, because I'd done a lot of thinking about what do I need as a patient for my healthcare team. And I said, I am probably, because of my background, my healthcare background, I'm a high information patient. I want to, I want to know, I don't want you to withhold any information from me. I want to know if it's good. I want to know if it's bad. I want to know if it doesn't mean anything. And so that helped me kind of place myself in how to guide and be an advocate for my own healthcare. And I'm sure everyone on the phone has experienced some degree of frustration in just navigating through the healthcare system. And I can't encourage you enough. This is going to be the most important thing you do for yourself in order to have the best outcomes. And if you're not comfortable with it, find somebody, a friend, a spouse, a caregiver who can, and now thankfully, now that COVID seems to be waning, more institutions are letting a friend or family member come into the office with you. That's so important because you have another set of ears to listen to what the doctor said, even though, and even though I understand a lot about the disease, et cetera, I still, walk out of the office and say, now, what did he want me to do? So make sure that everything, ask your doctor to write things down, put it in your, the instructions in your visit report, but also come to the office, and I'm sure you guys have heard this, come with questions and concerns. If something doesn't feel right to you in your own body, be persistent. I had a hip pain recently it just started. I didn't even know it was my hip at first. The physical therapist actually told me, and it just got worse and worse. And I had 2 surgeries. And what they found was that my bone was dying in my hip because of long-term steroid use. And I eventually, thank goodness, got a replacement and a hip replacement. It feels much better now. In the course of that, they found that bone death in my other hip and both of my shoulders. Now, that was something that, I kind of stumbled upon, but now I'm alerted to the fact that I probably have a lot of orthopedic complications that have to be looked at, which again, if you're seeing your oncologist, who sometimes with leukemia becomes your primary care physician by default, things can get missed. And that's why it's so important to, if you feel something, be persistent. Don't let it get brushed off, because, it's you going home with this disease. The other thing I can tell you is at City of Hope, they were actually one of the pioneers in the LA area of using advanced practice nurses, nurse practitioners, and physician's assistants to be another team member. And they're used really effectively at City of Hope, in my opinion, because the nurse practitioner always comes in ahead of the oncologist. And first of all, advanced practice professionals have more time with you. And they also, especially nurse practitioners who are trained in patient education, they're very good at education and listening and taking the time to really figure out what's going on. And so if you can find a situation where there is a nurse practitioner, and I know in a lot of places they utilize them very well, that could be another thing that you'd want to look for, in my opinion. It's funny, my husband was just, he has a cardiologist, and he saw the cardiology nurse practitioner once. And of all things, with me being a nurse and being sick for all this time, and he said, well, I just saw the nurse practitioner, and I was in the room with them, and I said, that was probably the best cardiology that you've gotten in 5 years, because it was so thorough. And then went back and teaching, this is what this means, this is what this means. When you're researching about AML, other than groups that are organized by an institution, these blogs, these patient blogs, can really get you off track. And I would really encourage you, if it's acting as a support group, that's great. But sometimes I go on, I see a lot of homeopathic medications and supplements. And the thing to remember is, if something is recommended to you, always tell your doctor, because a lot of the supplements interfere with the proper metabolism of some of your cancer drugs and can actually be dangerous. They can either lower the absorption or lower the metabolism, which means you actually are seeing much more drug than you should be in your body. So if you're going to do something before you try anything, usually the data on these supplements is quite sparse, but check with your doctor. I have had a few supplements, have tried a few supplements for things like bone pain. I haven't found them successful, but before I tried them, I always spoke to my doctor or other healthcare professional to make sure that I wasn't, screwing up my traditional treatment. And also, if you go online, I've done a lot of kind of browsing around to find places like this that do have a lot of information on them that's been reviewed by physicians for accuracy. There are two sites that I found that their patient materials are really pretty good. That's the Mayo Clinic and Cleveland Clinic. It's not, I know, this is not an endorsement. It's just been, in my experience, their patient-related materials have been excellent, and they really cite all the data that supports different drugs and et cetera. So that's so important to look at. Be careful of the site that you're browsing on. If you accidentally get on a sponsored site that's advertising something, it's not going to be as unbiased, because obviously it's usually encouraging you to join a clinical trial or look at some kind of special medication or something like that. And keep going to these informational sessions. I found them incredibly helpful. And I wanted to call your attention, if you're not already familiar with it, is the Leukemia Lymphoma Society. I've been quite active with them, do a lot of talks for them. Their patient information and materials are just fantastic. In my view, they're not so complicated that a person without a healthcare background can understand it, but they're sophisticated enough that you really get a lot of information from them. And most of them have in the back of the booklet, they have a glossary that has all these terms and has that you can follow up with. They're really excellent. And I wanted to call your attention, just when I started talking to Katie, I received a notice from Leukemia Lymphoma Society. They now have 3 books on age appropriate for long-term survivorship, which is something I've been begging them for a long time. They go over things like dealing with body image changes, which, some people are embarrassed and say, well, I don't want to be vain, but this is a big deal. You've lived in this body for a long time. And all of a sudden, you don't recognize it when you stand in front of the mirror. They talk about getting support and help other than medical. I was blessed at kind of one of the darker times in my experience to have one of my sons come in and say, Mom, you have to talk to somebody. You really do. And through resources, I actually spent 3 months speaking with once a week speaking with a grief counselor, because so much of what you experience is really losing parts of the life you knew. You're giving up things like, I loved running. I won't be running anytime soon. And so, those are big losses for I think for yourself, and sometimes you don't even realize it. And I found that really helped me turn the corner. And she also gave me some tools to deal with my emotions, guided imagery and stuff when I get anxious, to sort of be able to talk myself down. And so I think those are the things that often get overlooked. They ask at the doctor's office, how are you feeling? Do you feel safe? Do you want to harm yourself? Those are the standard questions, I think, that almost every doctor's office said. But, there's a lot of space between not feeling great and wanting to harm yourself. So you just need somebody to talk to and sort out your feelings. And usually family is very tough to talk to about that. It's a tough experience. So again, I want to encourage you to, as you get farther out, the other thing is that chemo and radiation, I'll just wrap up with this. Chemo and radiation, I was told by my endocrinologist, ages your body by about a decade, which was quite galling to me when I heard that. although it does explain a lot. And the other thing that it does is, if you're immune suppressed for a long period of time, not only are you more apt to get infections, but also other malignancies can come up that your immune cells would normally go after and stop it. So things like skin cancers, and I'm constantly screened for thyroid cancer because I have a lot of nodules which are pre-malignant. Changes to a woman's anatomy. You need regular gynecologic support, looking for that, and obviously mammograms, things like that. For men, the regular, if you have prostate exam and things like that are so common, because not only are cancers it's a fact of aging. Cancers are basically old people's diseases, to say it inarticulately. And if you're immune suppressed at the same time, or if you've been on a lot of treatment that impairs your body's ability to react to that, you really need to keep up on your screenings and then follow up. Right after my diagnosis, I had a very large basal cell skin cancer removed from my clavicle and my collarbone. And since then, obviously, I go in every 6 months and have a skin check with the dermatologist, because once you've had one skin cancer, you're really predisposed to have another. So I know I gave you a lot of information here, but a lot of it was what you can do to help yourself. Get to the right doctor, figure out the kind of patient you are, be an advocate for yourself, ask questions, be persistent, do your research, and stay well and try to be happy, I guess, is what I would caution everybody. Really try to do the most you can for yourself. And with that, I hope that maybe triggered some questions and also was helpful to everybody.
That was excellent, Ilana. Thank you so much for sharing your story with all of us and all of those great words of wisdom and practical advice that you gave out. It's really invaluable for all of us to hear. And I really appreciate you for being honest and vulnerable with us and telling us that, even 7 years out, it's still a struggle. I know so many people can relate to that. So great words all around for everyone to hear. I'd like to start our discussion session. And as a reminder, you can ask your question by either making a comment in the chat box or by raising your hand if you'd like to speak out loud. We want this to be interactive, so don't be shy. I'm going to check the chat box here. I think I saw something come in. Let me read. A comment here saying, thanks for sharing regarding appearance recovery. This is very much overlooked. Yeah, that's a great point, and I'm glad that was touched on. Is there anything else we as a group would maybe like to say on this topic? I think something in your presentation resonated by saying that so many things are not the same after the fact, whether that's appearance or the way that we feel, or the things that we used to enjoy doing. And a lot of modifications have to be made, and maybe even new self-discovery on body image and how we feel when we look in the mirror. I think that's a really important thing to talk about.
Also, one thing that I don't know if other people have experienced this, but because of the radiation treatments at City of Hope, they do 11 full body radiation treatments, which were worse than any of the chemo. I hated them. 3 a day for 3 days and then 2 more on the last day. It was awful. But, in the long run afterwards, I realized that it affected my taste buds. And a lot of things that I used to love, salads, and, I ate a lot of fish and poultry, and it just didn't appeal to me. I craved beef, which I've never even liked, but it has a stronger flavor, and I say to my husband sometimes, God, I'm in the mood for a steak. And he would say, who are you? Because that would be not the comment coming from me. So that's another thing that slowly my taste buds have gone back to the way closer to what they were before. But I never was prepared for that. It was weird to me. And everybody says, oh, ask your donor if they liked beef. But I think the more scientific explanation is that your taste buds kind of take a beating from all the chemo and radiation, and it affects how your enjoyment of foods that you used to enjoy. So I forgot to mention that.
Yeah, that's a good point. I worked for many years as a registered dietitian with cancer patients, and I heard this across the board with all sorts of cancer treatments, and it's so different for everybody, how the taste buds change and when the tastes come back. Usually we say it's about 6 months to a year, but that's never set in stone for people. So
yeah.
Another comment here, or question here, saying, with taste buds being affected, did this affect your sense of smell as well?
I think so, yes. I mean, it's subtle. I can still smell things, but I don't smell the very, I used to always wear perfume, and I just don't anymore. There's no real reason for it, or cologne, when I was working. I don't smell it anymore on myself. So it's I said, well, why do it? So I do think that it's mildly affected for me. But also after the radiation, there's this whole situation with your eyes are dry, your salivary glands don't work right, so your mouth is very dry. If somebody hasn't recommended already, there are some products on the market, toothpaste and mouthwash, specifically designed for dry mouth. And I really found that helpful, and I'd go use the mouth rinse a few times a day, and it really seemed to help me if I did it a little bit before a meal, because I got my saliva going there. So, those are those little teeny things that nobody tells you. You only hear it from another patient.
Yeah, that happens quite often. We don't always get the full picture until we start probing and talking to others who have been through it. Hence the valuable nature of these get-togethers, definitely. I'm not seeing another comment come through quite yet. Maybe I can prompt everybody. I'm curious if anybody else is in the group has experienced GDHD, acute, chronic, what your experiences were. That way we can kind of hear multiple perspectives. So if you want to share that in the chat or raise your hand as well, we'd all love to hear your experiences too. As I mentioned, that something else came through from Julie, which says, thank you very much for sharing your experience. Is there anything that healthcare providers and/or pharma companies could have done better to support you through your treatments, such as providing some specific educational materials?
Yeah, I mean, I'm really a fan of so many of the pharma companies. With the long term, I'm on 2 meds that I have to get through a specialty pharmacy. They're considered chemo meds, even though they're not technically. One is sirolimus, which is they're both immunosuppressants. The other one is Jakafi, which is an amazing drug. It's really done a lot of good. I was also on ibrutinib for a while. All of these drugs, which are used specifically for GDHD, the pharmaceutical company has programs where you can talk to a pharmacist or talk to a nurse about it. They have, about specific, let's say, side effects, and also help with your copays. These drugs are incredibly expensive. I mean, if I just had Medicare insurance, we'd probably be paying $40,000 out of pocket a year, just because of the gaps in coverage for the drugs that I need to stay, just stay well. So, but I do think that their programs are good, and talking about new treatments and stuff. Again, if you get on the LLS or HealthTree, there are a number of programs, but Leukemia Lymphoma Society has quite a few programs. There was one just late last year, on new advances in AML. And I always pipe up and say, how about in the chat room, how about new advances for GDHD? Because that's the gift that never stops giving. It really is the chronic disease. So, I'm hoping to get stasis, and with some patients, it does seem to result, just kind of get better for reasons that are not quite completely understood. But again, I'm looking at the chat about my skin. It's the miracle of makeup. No, fortunately, the changes in your skin from GPHD really affect your face. The rest of the body, not so much. So there's a lot of scarring and discoloration. My grandson, whose favorite animal is a cheetah, says that my back looks like a cheetah because there's brown discoloration that comes from that, and that the brown spots eventually will turn into scar tissue. But thank you for the compliment. Thank goodness my face was spared. And the other thing is that if you can find a hairstylist who has experience with cancer patients. I just started going to one because I had been cutting my own hair for like 25 years. And my hair was just, when it grew back in, was just weird. It was coarse. It was, it was a different consistency. My hair used to be very fine and wavy, and it was straight. Yeah, I couldn't get it to curl to save my life. And so finally I went to this, I heard, through connections, just asking around, that there was a hairstylist that was quite experienced with cancer patients. And when I came in, she said, so the first thing we're going to have to do is chop all your hair off, get it really short. So she cut all my hair off in the back, and she explained to me that medications can actually get into your hair cuticle. And, it can affect, like if you're used to dyeing your hair, it can affect the color, the consistency, and the best thing is, she said, just chop it all off. So, those were things I didn't know and that was a really useful resource because I was very frustrated with my hair, vanity, but oh well. So that's something to look for.
Yeah, something else came through the chat just now from Jeff, who says, thank you. I've been stressed about relapse. I've had 2 transplants, and the first I relapsed 2 years after transplant. The second one, I'm a couple months past my second year since transplant. Does anxiety concerning relapse eventually subside?
Yeah, what really helped me was just time. Once I got past 5 years, my doctor showed me the data, and it said it's very, very, very rare after 5 years. So if you get 5 years out, I can so empathize with you because I had a super duper strong transplant. In fact, they had to dump half the stem cells that they got from him because there were too many for my body. There's a certain ratio of stem cells that they can put in, and they said he had so many stem cells in the sample that came from Florida. But I would say yes, but finding ways to manage your anxiety, because you're always going to be worrying about something. I think that there are times where you just feel like, I don't want to do this anymore. And, I was talking to Katie, and I don't know if this resonates with any of you guys, but, particularly in the US healthcare system, disease is seen as an enemy, and we have to battle the enemy, and we have to be warriors. And, I know I get this, you're such an inspiration. I always get this from people, and you're such a warrior and keep fighting. And I'm like, sometimes you get tired of fighting, and, you need somewhere to have that soft landing in a safe space to be able to just say, I'm worn out. I don't want to do this anymore. I'm really mad and sad about how, my life has been turned upside down. But I do think that it's really about time. Once you get past 5 years, it's very, very unusual to have a relapse after 5 years. So I wish you well. I know it's tough to have your leukemia coming back after a transplant, but hang in there and, keep going to the doctor. Don't let things fall through the cracks.
Yeah, that kind of was timely to a few of my thoughts I was thinking about throughout your presentation, and that when you first had your transplant, the doctor said, it's not if you have GVHD, it's when. And you said you did really well for the first 2 years. And I was curious about how you navigated the time before GVH hit. Was there a sense of anxiety around kind of this waiting period that you endured? And how did you kind of navigate that? Did you put it out of your mind? Were there coping strategies? How did you kind of spend that time?
Yeah, that's a really good question. I felt really good physically, not well enough to start running again, but I was exercising and having PT. I felt I had really a fair amount of energy. I didn't talk too much about fatigue, but for anyone on the line who has GVHD, I mean, in general, post-transplant, you're fatigued a lot, but once you have GVHD, that's one of the primary symptoms that, for me, hasn't really gone away. I have good days and I have bad days, but you have to look around, and I've been thinking about how do I manage anxiety, and one of the ways is keeping busy. So for me, I became very, very involved with LLS. I did a lot of patient talks. I did a lot of talks for corporate teams that they were trying to recruit to, do their fundraising. And my job was, as the guy from LLS said, my job was to make them laugh and make them cry, and that'll make them open their wallets. So, that was how I did it. And a lot of my friends, because of my age, most of my friends retired, and many of them, we became Team Elon, and we did a lot of volunteer work. And before, the whole thing was kind of shut down, all these activities were kind of shut down by COVID. And so that was the way that I handled my anxiety. And try, you be aware of what's going on in your body, but try to do that tightrope of not obsessing about it. And finding other things. I was able to get back into the garden. I do a lot of gardening. We live on a large property, and that was one of the favorite things that I would do, even though it was more limited basis. But that was fun, cutting my roses and making bouquets for all of my friends and things like that. So I think dealing with the anxiety for me was keeping busy. But that's another reason to talk to somebody outside, for support, so that you can help a therapist, or, like for me, a grief counselor, I think will help you kind of find your space. Like, what is the way that you can manage? Because I'm a person that may be very different from you, and the way I manage anxiety may not be the same way. So I think that's important. Everybody is different, and having somebody to help you find your space is, for me, was super important. But I won't kid you. Some days I just say, this is getting really old. 7 years is enough. And, you just have to keep on going.
Yeah, I think pretty much with anybody who's gone through AML that I've spoken with, the anxiety is at the forefront of kind of the theme of what we talk about. And I think nobody's alone in that. And especially kind of with your journey going from feeling, okay, I've gotten over the hump of this acute illness, but now 7 years later, I'm dealing with more of a chronic disease, and the anxiety kind of morphs from that to something different.
Mhm.
And yeah, it's really important to talk about. And I think as a foundation, this is something we really want to help address in a way that's useful for each of you. So on the myeloma side of our foundation, we have a coach program, which is a mentorship program with more of a seasoned patient being connected with either a newly diagnosed patient or somebody who's going through something and needs somebody to talk about. And I think that will be coming soon for our program suite.
Right.
But if there are other ways that any of you would feel more supported, and you have ideas, we would love to hear them. So whether you want to share them as a group or email me individually, I'm always happy to talk to any of you, even if just having a conversation about your anxiety is something that's going to be of benefit to you. So please keep that in mind and put some thought to it. We'd love to help more with that, however we can.
I was doing a lot of that too. People would just find me and say, hey, I just was diagnosed. I know you're going through the same thing. And, it was kind of cool just to talk to people. Plus, when they're being treated somewhere else, it's, I had a couple of people who were being treated at Kaiser, and, some of the, not that, and Kaiser actually in Southern California sends all of their stem cell transplant patients to the City of Hope. And they have Kaiser doctors who are on staff there who manage the care, but they understand experience. But I do think that it's kind of nice to just have somebody to pick up the phone or text and say, hey, did you ever experience that? And, I'm still doing it for 3 or 4 patients. And it's as good for me. It's good therapy for me and hopefully helpful for them as well. So if you can find somebody that fills that role, that would be really great, Katie. That would be great to have that program.
Yeah, absolutely. Well, stay tuned for that. I think we'll go ahead and wrap up. I think that was a very productive discussion session that we had. I'd like to mention that our next adult AML chapter meeting will occur on March 1st at 1 p.m. Eastern. We're really excited to have HealthTree's financial coach, Diana Valentine, join us. Diana is a professional financial consultant and former caregiver to her husband who was diagnosed with blood cancer. She will speak to us about getting on track with our finances, and you will leave the event with a better understanding of how and who to ask about the cost of your cancer care. So a lot to be learned there. You can find the registration page for this event and for others by visiting healthtree.org/AML/community/events. That link will be given to you in our follow-up email. Once again, I'd like to thank our HealthTree community for AML sponsors, Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. And thank you all for helping us to build a strong HealthTree community for AML. I appreciate each of you here for spending your time with us, and I hope each of you have a great rest of your day. I can't wait to see you again on March 1st.
Bye. Thank you. I had fun, so thank you for the invitation, the opportunity.
Thank you. Thanks for your time, Ilana.